Hi, welcome back to Open. Since 2009, the Robert Wood Johnson Foundation County Health Ranking Report has ranked the Bronx, and I hate this, as number 62 out of New York State's 62 counties in terms of health outcomes. In response, several groups have come together to build a collaborative effort with partners and Bronx residents to improve the health of our borough. Not 62 is a borough-wide collective impact campaign designed to work with partners across multiple sectors to address the social and economic determinants of health that impacts the overall quality of life for Bronx residents and help to create an environment where individuals can attain their best possible health. Here to tell us more is the facilitator for Not 62, the Director of New Initiatives at the Bureau of Bronx Neighborhood Health of the New York City Department of Health and Mental Hygiene. It's over there on Arthur Avenue. Please go and visit him. He's a great guy. My buddy Fernando Tirado, nice to have you with us.
Gary, it's a pleasure.
Always a pleasure. Listen, we could go through any number of health issues. I know that the Department of Health and the folks over there at the Health Action Center are working really hard to combat this opioid problem we have. So let's just start where it comes from and why so many Bronxites and frankly people all over the country are having a problem with opioids.
So opioids are a crisis throughout New York State and throughout the country. We have a serious problem here in the Bronx. In 2017 and 2018, the Bronx had the highest number of people dying and the highest rate of death out of any of the city's 5 boroughs. But even when we look at the Bronx, when I tell you that number, we're looking at the average. We know that there are certain communities who are hotspots, who have a much higher rate of death, and it is tied to many times to the social determinants of health, which is why we wanted to talk about those social determinants of health, but also provide some practical help by distributing the Narcan.
Right. Let's talk about those social determinants. And there is a call constantly for more support for mental health services and those kinds of things. And, you know, we look at why people may turn toward opioids. I mean, there's the whole pharmaceutical question. We know all about that. But let's talk about mental health support. If you are a person who has or feels like, gee, I got some issues I want to deal with, or you have a relative who has issues, what do you do? Who do you call? How do you handle it?
So the first thing we would do is recommend folks to call NYC Well, 888 NYC Well, so that they could.
I didn't even know that. Let's get that down. NYC
Well.
Well, W-E-L-L.
W-E-L-L, and that is you can talk to somebody 24 hours a day, 7 days a week. You can text somebody, you can chat with somebody online, and they can tell you where you can get mental health services, including where you can get free Narcan.
As far as mental health, doctors available, psychologists available. Frankly, sometimes it's just somebody to talk to who's not going to judge you. I mean,
so
let's start there.
I'm not sure if there are doctors or nurses on NYC Well, but we do know that there are a lack of mental health providers in the Bronx, and that those mental health providers are not equally distributed throughout the borough. In addition, we know that more Bronx adults report more mentally unhealthy days than in any other county in New York State.
I hate this. I'm sorry. I love what you're doing, but I hate hearing about this about Bronx people.
And that's also from the county health rankings, right? And it's a consistent problem.
Yeah. Okay, so people have an opportunity to at least reach out, to find somebody to talk to, or a relative or caregiver who has somebody that needs help. Let's do that. You could go down, for example, to 3rd Avenue in the area around the hub, and you see people, frankly, who are strung out. It's very, very tragic. Yeah. If you see somebody who is having a problem, what do you do?
So we also like to promote our mental health first aid course. Tell people to take the course. It's an 8-hour course. It's a 3-year certification, and it helps people to recognize the signs and symptoms of depression, anxiety, suicide risk, substance use, and other mental disorders, and how to act and how to save somebody's life when they are in danger. You know, whether that is administering the Narcan or learning how to talk to somebody, learning how to discover what is at the root of their mental health issues. Because as we mentioned, there are certainly not enough providers in the state, in the county to help people. And so we need to train each other and help people understand where there are mental health problems.
And some of the mental health problems can be genetic, and some of them also, listen, it's tough out here in the Bronx. We know
Well,
it, and there
yeah.
are pressures of family and school and housing and certainly
Poverty plays a huge role.
Yep.
Racism plays a huge role. Structural racism, even the things that we may have, say, well, how is that affecting people now?
Oh my goodness.
Things from
Don't
Jim
even
Crow
start-
and
oh,
redlining and everything
For
plays a
sure.
part. Yeah.
And people who have lived through so many things and say, I've had enough, and now they're rezoning my neighborhood or whatever it is, and they,
So those economic stressors, those psychological
get
stressors,
it.
they all play a role in what's going on. with
Let's
people's
talk
mental health.
specifically. I know you brought some
Sure.
things to show us. Let's show some of the things that you brought with you
Sure.
to just talk about if somebody is having an overdose, whether a friend, a relative, or even a stranger on the street.
So actually, I was at a training. I was providing a training last night in City Island for the folks on City Island on how to use Narcan, how to recognize the signs and symptoms of an opioid overdose. And we talk about what you should do first, right? Make sure that you're calling 911, make sure that the person is unresponsive, right? We don't want people to administer Narcan if they don't need Narcan. But then how to administer it. It's very simple. There are these nasal
I'm going to
canisters.
hold one
Sure.
as well, if you don't mind. It's like a little spray bottle thing.
That's right. You put you hold the canister, 2 fingers by the base of the nozzle,
if you can
the
see me
thumb on the
doing it,
plunger,
yeah.
and all you do is make sure that person's laid down flat on the floor, and you administer the Narcan.
You literally put it in their nose.
You put the nozzle in their nostril, and you press down. Wait 2 to 3 minutes. If they're not responding, use the second one.
One time you squirt it one time?
That's it. There's only one dose available in these.
Can I assume that you call 911 first?
You're going to call 911 first. You're going to
Okay.
check to make sure that person is
And
non-responsive.
then
call
what
911
do
first.
you expect to happen after you administer this?
So what actually happens is that the person goes through rapid withdrawal, right? Just like fentanyl and opioids can, fentanyl in particular can cause a rapid overdose. This causes a rapid withdrawal. It helps that person to restart their breathing and to get oxygen into the system. But they're going to be afraid, confused. Sometimes they're going to be pissed that you took away their high. And so we want to make sure that you explain to them that not that they were overdosing, right? Because that starts to label people, but that they stop breathing. It could be as a result of the drugs that you used, but that this medication helped to restart your breathing, helped you to get so that you could go to the ambulance and go to the hospital and get the treatment that you need.
Let's be clear. This literally saves people's lives.
Yes.
And you've seen it happen, and you might even know cases where
I
somebody
know cases,
has actually passed, has actually died because this wasn't administered on time.
Yes, well, that's probably true, especially with the prevalence of fentanyl in the drug supply, right? Fentanyl, whereas with previous heroin use, it might take 2 to 3 hours for you to have an overdose. Fentanyl, it's 2 to 3 minutes, and if you don't know that a product has fentanyl in it, and you're not prepared, or there's not somebody there with a canister of Narcan to save you, that you're going to pass.
I love what you're doing, the Fernando Tirado. I love what the Department of Health is doing and how hard you work. I'm sick of not 62. My goal is when we get to 48 to say not 48. I don't want to hear it anymore.
Yeah.
We're done with that.
So you or I are like-minded then.
I think many people in the Bronx feel that way. Fernando Tirado, thank you and all our friends at the Department of Health. If you have questions, get on over to the Health Action Center on Arthur Avenue. It's a wonderful place, wonderful people, and learn a little bit more about how to save lives.
Thank you, Gary.
Always great. Folks, the mental health first aid training is taking place every day from today till Saturday, December 14th at 8:30 a.m. Also, the overdose prevention and reversal training will take place on Wednesday, December 18th at 10:30 and another class at 3:30. Both events taking place where? I just told you, the Bronx Neighborhood Health Action Center at 1826 Arthur Avenue. For more information on Not 62, visit your doctor. No, you can visit the Facebook page at Not 62BX, and we'll have more open right after this.